I love how you go into a lot of depth with your answers. It's really helpful. And then XX, which I think are kisses.
Okay.
Because I think the O's are hugs.
Wow, I never figured that out.
Tell us in the comments. And then please can you ask how to treat small cuts and grazes, please, XX. And then a kiss emoji, which I think confirms that the X's are in fact kisses.
I see where you're going.
Okay, so we're talking treating small cuts and grazes and also lots of buttering up. I won't confirm that that's the reason the question was chosen.
To get picked, yeah.
Yeah, but.
No, I did see this one and I picked it because we get lots of first aid type of questions like what to have in your kit and when to call the vet, and this just seemed like a natural progression. And I don't think we've ever really talked about it because it's hard. People seem to have a problem with seeing a problem in their horse and then calling the vet. Like they think they're going to bother the vet or they're going to get charged or the vet's going to think poorly of them, or not sure what it is. But as you gain experience and wisdom and practice treating wounds, you'll probably call your vet less and less. But I absolutely would not hesitate to see something on my horse, clean it up a little bit, take a picture and text it to your vet and say, is this something you need to see, or am I good just kind of following your advice and handling it on my own? That seems super easy, super fast. They'll thank you because trust me, they'd rather hear about it at the beginning when it's just happened and not a big deal than 2 weeks later when it either was a puncture that you didn't recognize, it was over a bad place like a joint, it involved structures, it developed maybe proud flesh, and then they have a massive problem, and you won't be happy either because now it's more expensive, and instead of being healed in 2 weeks, you have to start completely over, and it might be 2 months now, and your whole show season's gone. So I really think until you and your vet have a good understanding of what your level of expertise is and their trust for you, just send them pictures and say maybe they'll say, you know what, I'm really close, I'll just whip by and take a peek. So the first thing though, you do even before you take that picture, and with any wound, even if you're sure that you're going to treat it yourself, is clean it. And I think people might be shocked to learn that probably the best thing to clean a wound with is water. Just
how revolutionary.
I know, and cheap. You just get one of those fancy heads that turns, and you can do like all these different choices of streams.
And the mist and the shower.
And use the shower. Use the shower setting and clean it up. Get the debris out of it, the big stuff you can see, and then that also will flush it with the bacteria that you can't see. And so clean it up a little bit, and then you can take your picture or whatever. The other good thing to clean it with is saline. And that's something you can get from your vet, or I think you can probably get it from drugstores and whatever.
Yeah, absolutely.
Pretty, and it's cheap and it's easy. That's the best stuff because it's isotonic, meaning that the water will irritate the cells a little bit, but the saline is exactly what they are bathed in already. And so they're like, ooh, more lovely warm bath, so that's good. But they say nowadays, try to stay away from the betadines and the chlorhexidines because they don't do any better job cleaning out the wound of the bacteria.
Wow. Surprising.
Yeah, and they do a little harm. Because my oath that I took was do no harm. So we don't want to get in there and kill any cells of the body because we need those cells for the healing portion of it. The other thing that you can clean with is surfactant-based wound cleansers. Things they have, they sound terrible, but polysorbate 80, and there's another chemical, but the surfactant-based tends to collect debris and bacteria and cleanse the wound without doing damage to the cells. So water, saline, and surfactant-based wound cleansers, the ones that are designed for that.
Okay.
Are the ones you clean it with. And then everyone wants to put something in it. Don't you?
Goop it up.
There is it's just human nature to put something in it. And goop it up is a good term. It's the same principles up here. We don't want to do more harm. So really there's only 2 things that veterinarians now say, and you can tell they're doing research on this all the time. There's only 2 things that vets say now to put in there. Triple antibiotic, good, good old standby, and silver sulfadizing cream. I think we have the
We do indeed.
Just triple
We have
antibiotic.
triple AB.
And we carry that only because it really should be in every horse owner's vet kit. And you can get it practically anywhere. So just always have that on hand. And it's so cheap and it's so small. Don't use it and then have a little rolled up, icky, dirty tube. Like, just throw it away, get a new one. I mean, you know.
It's pretty cheap.
But the key with that, even as safe as it is, you only use it for the first 3, 4, 5 days, and then you stop using anything in there, because the phases of healing are that first you have to stop the bleeding, and obviously I didn't mention that earlier, but if there's bleeding, that needs to be stopped, and really a wound that's bleeding a lot needs to be seen by a vet.
Yeah.
All right, so the body does that, and then the body sends white blood cells there as part of the inflammatory phase to clean it up further. They help get the bacteria out. Maybe your cleaning didn't do. And then the proliferative phase begins, and it's where the wound bed granulates in from the bottom or the inside out. And then this is really cool. When it gets to the skin layer, the skin cells, the epithelial phase, they close the gap in a leapfrog fashion.
Yeah.
So that's why you don't want a goopy,
Yep.
goop it up. You don't want that in there because it prevents them from leapfrogging. They're in this ointment and they're
Can't
like,
leapfrog if it's slippery.
leapfrog. Yeah,
Can you
so-
imagine on a slip and slide
Yeah.
trying to leapfrog?
So in
Disaster.
the inflammatory phase, fine, but in the proliferative and the phase where they're leapfrogging over, you don't want stuff in there. You might want it covered. Good question for your vet. That's why the picture and talk to them. But once the wound is covered itself and you can't see that really bright pink tissue anymore, probably doesn't need bandage and doesn't need anything from you. And I mean, you look at it and observe it and make sure it's continuing to heal correctly, and there you go. So.
Never be afraid to send pictures to your vets. Technology has helped us hugely with this. I have texted my vets or emailed my vets pictures of cuts, but also things like pictures of poop. If you're concerned about the consistency or the normalcy of what you've got going on with your horse, and they're not shy, and they've got those data rates. They got that unlimited data. They can take those pictures. Yeah. And if you guys don't have one of those, if you're just using a straight hose and you want to experience the luxury of the shower setting, it's the ultimate hose nozzle that you can buy that has all the crazy different settings.
Yeah.
It's pretty great.